Thank you for joining us for the 2023 United Healthcare PPO Dental presentation. Today, we are going to go over the benefits of the dental plan and how to find a provider. This video will answer the most commonly asked questions. Most of you may have medical insurance, but that plan does not cover your dental needs. Having a dental plan this year means that you do not have to worry about unexpected major expenses. There are plenty of times when a patient goes into the dentist for a cleaning and finds out that they need a filling. If you do not have a plan, this could be a big expense for you. However, if you do have a dental plan, you might only have to pay a small fraction of the cost for a filling. Now let's look at how the plan works. Similar to the PPO medical plan, this dental plan does not require you to pick a primary care doctor. And this PPO plan has both in-network and out-of-network benefits. However, it is always best practice to try and find an in-network provider with United Healthcare, so that you can get the benefit of the negotiated rates for services. When you go to an out-of-network provider, United Healthcare does not have a contract with them, and it is likely that you will pay more for those services. First, let's go over some of the basics of the PPO dental plan. Number 1. This plan has a maximum benefit of $2,000 whether you go to an in-network provider or an out-of-network provider. Number 2. This plan has a one-time-a-year, $50 deductible for basic or major services. If you have dependents on the plan, the maximum family deductible is $150. And this deductible does not apply to preventative care. Number 3. Your plan this year includes a lifetime $1,500 child orthodontic benefit. PPO dental plans are always divided up into 3 major categories, and for each one of these categories you are responsible for a percentage of the cost, except for preventative care. Number 1. Preventative care is covered at 100%. This includes 2 cleanings a year, usually 6 months apart, radiographs, and an oral examination. Number 2. Basic services are covered at 80%, which means that you are responsible for 20% of the bill. This includes fillings, oral surgery, extractions, and endodontal and periodontal work. For example, a root canal or a deep cleaning would be covered as a basic service, which means that you will save more money on this plan than on others that consider a root canal a major service. Number 3. Major services are covered at 50%. If you need a crown, denture, or bridge, they will be covered at 50%. Orthodontia is covered at 50% as well. Keep in mind that when you go to an in-network provider, United Healthcare has a contract with that dentist to save you money. Things to note about your plan. When you go to out-of-network providers, the percentages of coverage are the same, but remember that since there is no contract with that provider, the cost will be more. Your plan has a rollover feature if you used very little of your benefit last year. If you qualified for this feature of the plan, this year you will get an additional amount for your annual maximum. You will be able to use this additional coverage if you need it this year. We always recommend that for any work over the amount of $300, you request a treatment plan. This will help you understand the cost before you get any work done. To find a dentist in the PPO dental plan, go to myuhc.com, then click on Find a Dentist in the middle of the screen. Then choose Employer and Individual Plans. You will need to input your zip code or the zip code where you would like to find a dentist. The dental network that you need to select is the National PPO Options 20 plan. You will need to select either a general dentist or specialist. And then your list of dentists will be created. I hope that this presentation has answered some of the most common questions with your PPO dental plan. If you have any additional questions, please do not hesitate to reach out to us.